Welcome to Chapter 13, How Safe is Our Food Supply? This is a great picture because cantaloupe has definitely been in the news a lot in the last few years. We know that in 2013, a couple of Colorado cantaloupe farmers pled guilty to criminal charges in connection with a listeria foodborne illness outbreak that killed 33 people. They claimed they did not operate their melon washing system properly, and they were charged. Americans really do believe that all of their food has been inspected for safety and that the facilities in which their food is prepared and processed are certified to be sanitary and disease and contaminant free. But we know that this is cost prohibitive and impractical. There's no way that every single facility and every product, every minute of every day can be inspected. So what happens is sometimes food reaches us that is not safe, and sometimes it reaches us not inspected by anyone ever. We've heard a lot lately in book talks about a 2014 beef producer that recalled almost 9 million pounds of product that had never been inspected. The animals the meat came from were diseased, and a month earlier, the same company had been forced to recall 40 tons of uninspected beef. We know that foodborne illness annually gets about 48 million Americans sick and kills about 3,000 of us. Even our water is sometimes threatened, and we know that 1/3 West Virginians started out 2014 with contaminated tap water because of a chemical spill in the Elk River. But despite all of these frightening incidents, most food arrives in our homes safe and fit to eat, and it remains that way as long as we handle it properly in the home. The modern U.S. food supply is perhaps the safest in human history, but there are dangers still out there from people not understanding adequate food handling practices, and this can happen anywhere from the farm to the feedlot to the table. So we're going to cover quite a bit of those in this chapter. So how do we keep food safe? Well, what is a foodborne illness? That's an illness caused by the consumption of contaminated food. Have you ever had food poisoning? Probably whether or not you know it, you probably have. And oftentimes we call the 24-hour flu, that's usually food poisoning. But the technical term for it is foodborne illness. And most foodborne illness is caused by consuming food that has been contaminated by disease-causing microbes. And occasionally it's caused by toxic chemicals or other contaminants that find their way into our food. Usually the GI symptoms are abdominal pain, nausea, diarrhea, and vomiting, and that can cause even worse, kidney failure, arthritis, paralysis, miscarriage in pregnant women, and even death. So these bacteria, viruses, fungi, or parasites are microorganisms, and they cause disease, and they're typically referred to as a pathogen because they generate a pathology or some sort of illness. So the symptoms and severity depends on the potency of the contaminant, how much of it's consumed, how often it's consumed, the age, size, and nutritional status, and the number of chronic diseases that the person consuming it has. It also depends on the absorption, metabolism, and storage in the body of the bacteria or microbe, And it also depends on the person's immune function. We know that the people at highest risk are young people, elderly and pregnant women, and people with AIDS or on chemotherapy or on immunosuppressant drugs. There are agencies that monitor our food supply at the international, federal, state, and local levels. They're responsible to set standards and establish regulations for the safe handling of food and water, and for the information included on food labels. They regulate the use of additives, package materials, agriculture chemicals that are used. They inspect food processing and storage facilities. They monitor domestic and imported food for contamination, and they investigate outbreaks of foodborne illness. Media coverage of outbreaks of foodborne illnesses happen all the time. So we hear about this on cruise ships, deaths from E. coli infection, and cows infected with mad cow disease. And all of this has heightened public concern and led to the development of the National Food Safety Initiative. And the goal of this initiative is to reduce the incidence of foodborne illness by improving food safety practices and policies throughout the U.S. And we know that because the food can be contaminated anywhere in the supply chain, from where it's grown to when it's served in your home, this particular food program, the National Food Safety Initiative, targets food safety from farm to table. Okay. And additionally, the FDA Food Safety Modernization Act has been passed, and this legislation focuses on prevention of foodborne illness, not just reacting to problems as they occur. And it gives the FDA an inspection mandate and some legal powers to ensure that companies are doing their part to stop potentially unsafe food from entering the marketplace. So how do we keep food safe from farm to table? So at the farm, we know crops can be contaminated with bacteria before they're even harvested. So good agricultural practices help minimize contamination during growing, harvesting, sorting, packing, and storage. At the processing point, contamination of processed equipment can transfer microbes to food. So to prevent this contamination, there's guidelines set for cleanliness and training of workers. Protocols are developed to anticipate biological, chemical, and physical hazards that can occur. And manufacturers that process food establish these work to establish appropriate measures to prevent them from occurring. And then we have to transport all this food. So during transport, poor sanitation, inadequate refrigeration can contaminate food and let microbes grow. So clean containers and vehicles plus refrigeration can prevent the growth of foodborne bacteria. And then even at the table, safe food is contaminated very often at the home. A lot of people, probably you'll learn some things this week that you didn't know, that can cause foodborne illness. So if people don't properly wash their hands or sanitize equipment or thaw, handle, store, and prepare food properly, it can cause foodborne illnesses. And at the retail level, food can be contaminated during handling of storage in grocery stores or during the preparation in restaurants. The FDA has a national food code that provides recommendations for handling and service of food in an effort to help restaurant owners and retail owners and employees to prevent foodborne illness. And you may have worked at a restaurant or somewhere where they have local health inspections, or a hospital where they're inspecting to ensure cleanliness and proper procedures. So that's really the role as far as in consumers. So what is HACCP? You may have heard that before. HACCP is a food safety system required for food manufacturers, processors, and distributors. And what it does, it looks at food production, processing, and transport, what we just talked about at different points. And the goal is to identify potential points where measures can be taken to prevent contamination and to monitor these critical control points. So here it talks about eggs. They've conducted hazard analysis on eggs, and there's a large potential for contamination with the bacteria Salmonella. And we know that adequate refrigeration and heating can be preventative measures that can eliminate this hazard. So the identification of these critical points control the growth of Salmonella in the processing, and heating the shelled egg mixture in a large chamber can kill some of that Salmonella bacteria. So there are critical limits, parameters set to require sufficient heating time and temperature to kill some of that Salmonella. And these are monitored, and you can see the petri discs where they grow it to see what's growing and what's not. We determine a corrective action and maintaining proper records during this process until it finally reaches the consumer. So HACCP is what most businesses are doing from farm to table to make sure that the food arrives safe. So everybody has a part of it in it, not just one person. So what's in the role of the consumer? We know that government agencies and manufacturers and retailers are involved in creating this safe food supply, but consumers also need to assume some responsibility for their food. Even that it can be well taken care of through all these HACCP procedures until it gets to home. That's where we find a lot of foodborne illness happens. So consumers can prevent most foodborne illnesses through careful food handling, storage, and preparation. And you're going to learn a lot about that this week. And this will help you protect yourself and others if you identify unsanitary, unsafe, deceptive, or mislabeled food and notify the appropriate agencies. How do you report food-related issues? This goes into great detail with phone numbers to the FDA's main emergency number, email addresses, restaurant and food sanitation problems to your health department, alcohol beverages to the U.S. Department of Treasury, the U.S. EPA for pollution and pesticides. And for the grocery store, they really want you to return it to the store because grocery stores are very concerned with foods, the safety of foods they sell, and they'll take responsibility for tracking down and correcting the problem, and most often refund your money or replace the product. We're going to stop here because that's the first section and then move on to the pathogens in food.